We Infuse Podcast, episode number 44. Welcome to the We Infuse Podcast. My name is Dylan McCabe, and in every episode, we give you a seat at the table as we talk with infusion center owners and operators and experts so that you can get the insights you need to run a thriving practice. Now, in this episode, it's very special because I have a co-host with me. Her name is Amanda Brummett, and I'm actually passing the baton to her to be the new host, and you're going to see why by the end of the episode. She's very insightful and clear, really good communicator. She just makes a great podcast host. And we also have a special guest on the show. Her name's Melissa Paige. She's the co-founder of the Healthcare Advocate Summit. So you're going to get a lot out of this about advocacy, how advocates can leverage each other's knowledge and skills, really just making big waves in the space for patients and shortening that time frame of reimbursement and all that. So we're just going to get all into that, and you're going to get a lot out of it. So let's jump right into this episode with Melissa Paige. All right. As I mentioned, we have special guest on the show today, Melissa Paige with NMAPA. Melissa, thank you for joining us.
Thank you guys for having me.
And as I mentioned, we also have Amanda Brummett, my co-host, and very soon to be a new host of the We Infuse podcast.
Hello.
So, Melissa, we were excited to have you on because you're with NMAPA. You're also the co-founder of the Healthcare Advocate Summit. So before we get into all of that, why don't we just take a minute for our listeners just to hear who is Melissa Paige? How did you get into healthcare, and how did you land where you are today?
Yeah, thank you guys once again for having me. So I am a licensed pharmacy technician by trade. Started out with kind of retail in that Walmart world. I think if you can survive Walmart world, you can survive anything, with pharmacy. And just kind of moving along of what I could do with this pharmacy technician license. Of course, I started going into barriers right then with what is a prior authorization. And I think with each step, you learn a little bit more. So I went into the independent pharmacy technician role. And we did a lot of mail order, we did hospice, and we did just, care coordination of those patients. And once again, same thing, it's just a different level of prior authorizations and more white glove touch. And then I moved into working for a PBM and an insurance and actually being that prior authorization portion, because for me, you always want to know why. And I'm like, well, why don't I get a job in that? And really understand the back end, because I was getting denied a lot for my patients. And that's where I was exposed to clinical criteria, step edits, and really having those people call in. And if you've ever seen Incredibles, I felt like I was that person kind of giving all the secret sauce away of go to the left door, do this, make sure you submit this, and really trying to be helpful, because it was just turn around on that patient's case. And, from there, I went to the military treatment facility where everything's free. But now I'm dealing with wounded warriors trying to take 3 trains to come in just to get free access to care in DC, where I was at, and working with TRICARE mail order and understanding that. And it was great. So I felt like moving along, my last kind of step was working in a health system. And so I moved around a lot, but I would say I elevated my role with each of them. And so in the health system, I worked for a health system for over 10 years. That's really where I got exposed to kind of all those pieces that I had, but having patients come in and helping them out, I was really working with the 340B programs. We were giving away free medication to those patients as well who qualified. But then I had patients come in and they were asking me, I have Medicare insurance and I still can't afford my medication. And that threw me for a loop, because, I was able to get free drug programs, the 340B bulk replacement program, and trying to navigate that. So that's really where I understood the value behind what manufacturer resources could do for my patients. And it was just for oral medication. It was great. Figured out all the loopholes once again, and just access to care, and built our team out. And then I had those same Medicare patients come back and say, I can't afford my infusion. And I was like, okay, whoa. I know Medicare D. I don't know A, B, C, D, E, F, G, all the rest of them on their infusion benefits. And I think every health system is a little bit different, and there's no training guide. So you learn by failure. You learn by passion, empathy, trying to get through this. and really utilizing manufacturer resources, such as the START forms, the copay programs. And so for my facility, I had to really turn the value around of what these industry stakeholders had to our hospital, and not to lock these people out. You have lots of stakeholders. And, at one point they didn't want to let these type of roles in because they were taking away from patient care. And so internally, I had to show the value of like, look, you have a key account manager. This is what they're helpful for. A field reimbursement. They can talk HIPAA. They can pull through my patients, and what those account specialists to help educate the doctor. So I'll say it kind of came full circle on all these resources. I felt like I was able to turn around patients that sometimes took 90 days to now I was dealing with patients I could get under a week turned around into my infusion site, and really understanding these things. And, over the course of the years, we were having those site of care denials, and how do you appropriately fit those? So my partnerships with other infusion sites and standalone infusion sites really helped. And it was really a big task to understand all of this. So that's a little bit about me in a nutshell. I think I just wanted to know why so long that I hit everything I could with my pharmacy tech license, and I just found the value behind networking and those stakeholders out there to help you.
That's great. I like that you kind of highlight the different experiences you had and how it's all stepping stones to where you are, but you're an advocate at heart. So when you go to figure all that stuff out, you can really help people. It's so frustrating how difficult the insurance companies make it for everybody. So out of that, you obviously put your head together with some other folks and launched the Healthcare Advocate Summit. So tell us about what is the Healthcare Advocate Summit?
So the Healthcare Advocate Summit is, I would say, the stakeholder in between the physician and the patient, and who's helping champion through the appeals or the prior authorization process. And, that stakeholder within the health system, the private practices, really, I came across about 16 different titles with this role. It was like medication access coordinator, nurse coordinator, access liaison, patient assistance programs. And we found kind of all these different roles, and we were doing the same things. And I'll say how this ended up launching was I was trying to find other people who did my role. And you can't call up to a hospital or a place and saying, who does manufacturer resources? Like, how do you find your other friends out there? Because while I was an expert in my health system, what they thought I was, I never could grow because I couldn't bounce ideas off of. They're like, Melissa, this is such a great idea. I'm like, well, really, it's about 7 Band-Aid processes. This isn't, there's a smoother way to do it with technology and things. And I started going out to conferences, and it was really hard for me to get support from my health system, go out and speak about this and help support funding behind it, because I couldn't show the value of what I would get from the conferences. And so at about year 3, when, I thought these people were my friends just checking in, really, they just wanted to sell another ticket. It feels like now, right? Like they're like, hey, you come in. And I was getting really frustrated. I said, they're not going to support me again. It really stinks because by myself, I save, 1 million per month in my infusion center helping out these patients. And I need to do more. I'm just one person. And they said, do you want to come and speak on that? I was like, oh my gosh, is that all I had to do to kind of get into this circuit? And I didn't realize how valuable the voice of the customer was, and the voice of the patient into a lot of these conferences. So my journey for the next 6 years was going and speaking in conferences and networking the hell out of everything I could. And I found the people at the manufacturer who actually make the changes to the program. So it was like building this LinkedIn Rolodex, that if I saw something in a program that wasn't working, or if they were launching a new product, like, this is how you can get access. And while it helped me out in my institution, it helped actually the US population. And what I noticed there is I wasn't finding many people like myself at these conferences. And I kept kind of urging, like, we need to invite these people. These are who the manufacturers want to hear from. These are who the technology solutions, and at the end of the day, they kind of had a different ROI behind the type of conferences they do, the stakeholders they bring. And I couldn't push what I had wanted to do in what they already had built. And, these people do conferences like every month. And so for me, I was like, okay, I kept coming home and kind of complaining, like, there's no space for us. I can't find my friends. The same 10 people show up. And my husband's like, well, Melissa, you keep complaining. What are you going to do about it? And that's when I'm like, you know what? How hard is it? Let's hold our own. Let's have the people behind the scenes. We know what we're talking about. We can build an agenda that if we have any speakers fall out, how sometimes you see new speakers and new topics come. I was like, how great is it? We can build our agenda. We know what it needs to be. And if anybody drops out, I could speak on it. Anybody, like, it's just, we can keep the conversation the same and plug and play. And so that was what our journey was back in like 2018. And just really securing a place and trying to, I'm not an event coordinator. I mean, I can barely coordinate my life, and really leaning on others to help us through that journey. But the Healthcare Advocate Summit is for access and reimbursement and faster solutions to help out patients. And this event that we finally executed, I mean, it took almost 3 years, Dylan, and I was coming into the space. And normally a lot of these conferences are like, maybe 20 people to start out with. You see a lot of these chapters. And I'm like, how can we make like the biggest bang for this? My goal was 300 participants. I'm going to get 300. And that was my goal. And I wanted to make sure we could pull every health system in these things. And I think as we were navigating, we ran into multiple roadblocks. And, as you guys are still navigating, we're living in this virtual world with COVID, is the ability to pivot and turn when you run into a roadblock. And I think advocates can make the greatest event coordinators and planners, because, just like anything that we ran into, those weren't real challenges for me. And we went through some pretty dark spots with the conference of if we were going to be able to pull it off. But, at the end of the day, we just kept having to remind ourselves, like, access to treatment, quality of life, patients that may only make it one Christmas. Those are the real challenges out there. And so as we were navigating, and you pull the people together who just have the same passion, that's what we were doing. And so finally, I'm so proud to say we needed to have a live event. I was committed to a live event. We thanked all our sponsors for staying on board for so long. But we finally executed that event in September. And, I have some kind of stats behind that. But out of our 468 registered attendees, which we made it above our 300, we had 202 show up in Galveston, Texas. And it was wonderful on just the stakeholders we were able to bring together. So I know the team worked really hard on that.
Melissa, I absolutely love that you took both your passion for patients and this need that you saw and said, I don't want to continue to do this just for my patients. I want to teach everybody so that all patients can access that. It is amazing and awesome. In thinking about both your event and the organization, who are the stakeholders? Is it just clinicians? Do you include caregivers in there? Who are you trying to reach?
We had very few physicians actually come, because it really wasn't aimed towards them. At the time, they need to understand this role, but they're not the ones filling out the start forms. They're not the ones on hold with 42 different payers at one time. It was the stakeholders were those access coordinators. They were, let's talk about who our exhibitors were. Like, who were the people that would have found value into this group? It was the manufacturer, like patient services and market access, the ones who are, they have a hub right behind the scene to help you do benefit verification. They're the ones who run the copay assistance, the free drug programs to help. They're the field reimbursement, the reimbursement access managers, the people trying to find the people who are shoved in the basement and really no line of sight into. And so our exhibitors were specialty pharmacy, technology solution that actually helped the coordination of care, infusion scheduling, how to find these programs a lot quicker versus Googling the drug and trying to find these things. And also we had our foundations there as well, the nonprofits who help support alongside for those Medicare patients, or possibly uninsured or some sort of, underinsured, I'll say, patients. So when you bring all these stakeholders in, I think this was the first time that there really was a conference that it didn't matter which portfolio you support, which disease state, and it was those stakeholders. And I'm happy to say, out of the healthcare systems, and you know how many are out in the U.S., we had 75 healthcare facilities across 28 states attend this,
Wow.
both virtually and in person. And that doesn't even include private practice. We had private practice groups or really large GPOs attend. We did have one physician from Medico CX come, and he was great, Dr. Diaz. I think my favorite quote from him is, "You guys are all out here. I just want to let you know, I don't know crap about this process. Like being here and sitting here for 2 days." He's like, "This is why I brought the 3 here. They need to learn this, to help pull through his patients." And so getting those people together, the only thing that we wanted to make sure that for a first time event, that they leave with something. And they kind of did some reels, the teams did, but the empowerment that you saw leaving there, that they found other people who understand each other, who can talk this lingo, and they don't have to talk to their husband who doesn't understand anything about insurance. And leaving from there, the takeaways of this was from our exhibitors. They were just, while we only had 200 people there, right? They said the quality of the conversations was outstanding. I mean, normally, at exhibitors and things, you kind of go by and swipe the favorite pen, but you really don't want to talk to the people. I saw the swag left on the table. They were just there to talk. They came with their patient list of, these are the ones I'm having challenges with. And I think this year, what they proved is, while you could be a pharmaceutical company, even trying to sell this, the teams had struggle like, well, who should be there? And we're like, all your portfolios, rheumatology, oncology, every portfolio should be here because, when you work in a health system, you touch it all. But when you're in private practice, they still need to know the value of these stakeholders. So I was excited to hear kind of the outcomes of the reports. Just said they want more education, Amanda. They wanted to understand Medicare better. And I'll say we kind of dabbled in, when you go to events, you see continuing education credits. But for us, if I'm saying, hey, the whole world's invited to our party, you've got so many stakeholders. And so I was happy to say we had CEUs accredited, the same courses accredited for pharmacists, pharmacy tech, nursing, coding, this board certified professional advocate. So we took our courses and just like one-upped anything that I've ever seen of come. And so we had stakeholders that our attendees came, they were getting accredited for 3 different licenses that they were trying to keep up with. And so that's what they wanted more of. I've kind of seen the preliminary of what they're doing. They're doing multiple tracks next year with a potential of 30 hours this next year for the event. So yeah, I would say, those stakeholders, to sum it up, it's in between the physician and the patient. And I will highlight, coming from this, I didn't realize how many private advocates are out there, right? Where they can get hired on outside of a health system. You may do it for your mom or something if you're not there to go to the hospitals. And we uncovered this amazing group of private advocates that don't really they're doing great, but they can do better by understanding our role in the institution and how to find these people to connect. So I think from there, we're like, if they can have 5 conversations and get access to treatment. So I know we left an impact, and the teams are getting bombarded every day of like, where's the next location? Let's keep this going. So it's great. It's just that unmet need and making sure that you pull it through, and you just need to go off of just get energized by the people, just thankful that there's a stage for something. So
absolutely. That is so amazing. So you mentioned several different specialties in there that were represented. What all therapeutic areas do you guys cover?
So across the therapeutic areas, we had an outcome report that showed which therapeutic areas, but it was anything, Amanda. There was maintenance medication. There was cardiology, rheumatology, any of the ologies that are in the infusion space, and both infusion as well as like oral medication. And I think if you look similarly to NMAPA, which was the reason why this nonprofit was created, if you look at the symbol, there's an injection, an IV bag, an infusion bag, and a pill. And that's because it's really disease state agnostic. You still need to dive into these areas, but to us and to everyone, I mean, access is access, and challenges and stakeholders on that. So we had representation from everywhere. And I think that also shows what I've been through, because I've been at an infusion site in the entire health system. And sometimes I couldn't attend some of these organization groups because they're like, hey, we're just this disease state, or hey, we're this. And I'm like, why aren't we partnered? Like, why do I got to go to 7 different meetings? And while those organizations are still very important, I think there is sometimes confusion of like, what if you fit more than one? What if you don't know where you fit? And so I hope that this NMAPA organization really dives into both. And it's really, their motto is everybody's invited to the table. And boy, does that feel good.
One of the things I like a lot about what you're saying is, obviously when you bring all these people together, you can create a movement for something great. I keep thinking about that book by Malcolm Gladwell, The Tipping Point. And how he talks about, this takes 3 types of people for something to go viral or to hit the tipping point or whatever. The maven, the salesman, and the connector. And the maven's like the expert, the person who knows can get way more granular and detailed than anybody else. And then the salesman is the salesman, and the connector is somebody that just knows everybody and loves connecting people. But you guys are kind of doing all 3 with this Healthcare Advocate Summit, because you guys are kind of acting like a big sale. You're letting everybody know the possibility here. And I love that it's multi-specialty, because I've been to a ton of conferences, and I think this is unique because it's multi-specialty. Everybody's there to help everyone. It's really based on the advocate side of things. So it's not just another conference. It's not comparable. I don't know that there's another comparable conference out there. But you guys are really playing all 3 roles there. And you've got the people that show up, especially the sponsors that show up. They're really the mavens all in their own area to get really detailed and share that expertise. And you're connecting everybody, providing people a place to join together. So just love that.
Yeah, they were pretty surprised, because we had one company come, and I really thank everybody who continued to support the team on that. But I heard companies came, and it was just from, we'll say, oncology or that one particular group. And they had like 3 other people come up to them trying to find their person for other areas and portfolios. So I think this is why the need to have a live event, right? I think we're all Zoomed out, virtual conference out. I don't think we're ever going to go away from it. It's going to be this hybrid model, and that's fine. But the hybrid should really launch a live engagement. And so I'm glad we were able to do that. But when you talked about those 3 kind of stakeholders and what it takes to launch a movement, how do you be a disruptor? And I'll say it's once you find something and you find it, and it took me 10 years. I mean, it literally took me 10 years to finally find this and getting this platform together. And if we can expedite those new biologic coordinators, those new people coming in, not having a playbook for everything. There's other organizations that has great resources, but man, to be able to connect and right now, you hit it nail on the head, Dylan. Like my first 6 years of speaking, I'm like, I got to keep networking because one day it's going to pay off. And now when you hear something, I mean, the gratitude and just the energy that we get on helping others, or I'll say even when COVID shut down the first time, I'll kind of pivot here. We had to shut our event down 1 month before we were going to have it in 2020. And then we started getting all these advocates emailing us saying, I've lost my job. I'm on furloughed. Like, I don't know what to do. Is there anything that you can help out with? And so our job quickly pivoted to an advocate resource of here's how you interview, here's where your skills can be transferable into other areas, into like pharmaceutical, into hubs, into field reimbursement. to help them. And then we also partnered up with a bunch of physicians who couldn't afford a body in their practice anymore to do the prior authorizations. And we were able to help partner up with virtual prior authorization people now. So, I think the Healthcare Advocate Summit really is just the pivot of what is the need in the community at that point. But I'm so proud of what we came with. We all got hands on deck for just a COVID guide, because while they came out and stated, everything's going to be covered, it's okay. We know what documentation you still need when they come back denial. So the connector, and if we can have somebody else find their tribe, somebody else find their best friends, and to elevate each other, that's the room you want to be in. You want to be in the room that's continuing, that can talk about salaries openly, that can talk about elevating. And so from this, we're seeing, hey, here's how I help my patients, but here's also how I grow with the skill sets that I have. And but the layout of I'll say the whole event, it's just the first year we had to go through that patient journey. And, from the start of diagnosis to navigating into an independent infusion site, an infusion home health. And what was cool is we had people speaking on the topics from dermatology, oncology. Like we had each therapeutic area kind of talk about different journeys, because I didn't want it to be focused on just one area that people are like, okay, these are the only area like disease state that knew. So it was good. It was a good conversation. It was a lot of packed information. And so I think this next year we can really carve into the different areas and disease state areas if they'd like, and opportunities for, pharmaceutical companies to come and possibly have webinars and stakeholders. And because really that's where you find the value on how to get your patients on faster to those treatments.
That's great. Well, we have a lot of infusion center owners and operators listening to this, but a lot of owners listening to this, or at least leaders in their practices listening to this. So if they're listening, thinking, wow, the Healthcare Advocate Summit sounds great. What's the biggest reason that they should send somebody from their team to the next summit? I know it's hard to narrow it down to one thing, but I mean, what's the one thing you would want somebody to get and not leave without, their biggest takeaway they could expect to receive from attending this event?
I can confidently say that if you send at least one stakeholder, make sure to send the person who is doing the most work in your facility to help champion these prior authorizations through, because I know you normally probably have possibly 1, 2, just very minimal people on this, but we are talking about pulling through patients quicker, faster, and to be able to stay on treatment. As well as giving tools back to this person to really help you as an owner of a facility understand the ROI behind this. Like, how fast do you grow your team? Because I know that's a barrier where sometimes these advocates don't know how to measure properly. So you, as the owner or the physician of the practice, know that it's actually bringing back a return. And so we're giving those tools of those same challenges we've had to beat down the health systems doors that took us years. And so we've got those stakeholders who are more than willing to give this training and to help out. And I think for you as an independent standalone infusion site, you guys are partnering up with great organizations like NICA and these other great parties, but similar challenges are happening everywhere. Standalone infusion sites, health systems. And when you get together and you get to share ideas and share stories, at the end, they will come away with something. We have built an advocate justification toolkit that helps the physician understand. And Amanda, I know you're like cheering back there. It took me a lot to go to the conferences, and sometimes as one of the lowest paid workers in the institution, bringing back the biggest return on, insurance is paying, it was hard for me to advocate for myself. So even if there's others out there, we do have a tool. We have a letter. The teams have jumped on the phones with the owners, the practice owners, the revenue cycle, the chief operating officer revenue cycle, to help you understand, like, proving one person. And from what I heard, I mean, we didn't even talk about cost, right? What does this ticket cost? For anybody that's working in the patient journey, that is either a private advocate or supporting a physician, it's only $149. And we have it that way because we've really positioned it for the pharmaceutical companies, for the specialty pharmacy to like help us put this event together. And that's only for this next year. I've seen what the group has in the future. They'd like to get sponsorship to actually just fly out 200 people, right? Let's cover everybody, because if we can support those standalone infusion sites that are already trying to meet their budget and their forecasts that they want, we just all need to be working together smoother. So Advocate Justification Toolkit, we have tons of people that are just on the phones ready to talk, because we know for us advocating for our own journey or that. So I would say reach out. It's info or team at advocatesummit.com, but also NAMAPA, the National Association of Medication Access and Patient Advocacy. There's free resources and tools over there that I think a lot of consulting companies actually charge for these things, but the webinars, I mean, the whole goal behind it, right, is to provide those resources and tools to help out a patient that, you know, we treat everyone like it's our grandma, our family member, our child.
I love all of that. You're totally speaking my language. As somebody who's been in operations, I've spent my career justifying why we need to spend money to do the right thing. And it's brilliant that your organization gets out ahead of it. I love it. So you've hinted at a future event. Do you have any dates that we can share with the We Infuse audience, or a place where they would go to find the next one?
So what I would say right now, if they just, so I can't announce the full amount because they're like signatures are wet right now with the ink on that. But I would say it's going to be next year again, around the same time. So we had it in fall time, and we were making sure, or the team was making sure that it didn't compete with any other event area. But January, they're going to be announcing that on that. So I know they're super pumped on that, and they would be really mad if I announced it on this call right now before they went through. But I know just like what's the in between right now. If you end up going to follow on like this Instagram, Facebook, any of those, LinkedIn, they've got a big footprint on there. They actually have February 10th and 11th. It's called a Technology Solution Symposium. And they've brought all of their sponsors in technology to come back and to replay those, right? Their speaking sessions, and then also come on live, because I think for me working in an institution, it was always hard to find like, well, I need a software, but I don't have time to like talk to everybody, right? Or I don't know if they're even able to help me out, and they were taking time away. So these are the technology solutions that can help you out with patient care, prior authorizations, like the ones, if you're going to attend something, it's a free registration. We're doing it for free for all of those attendees out there, but the registration link is on there. It's an Eventbrite link. So that will get you dabbled into kind of what those topics are. But I know our technology partner solutions are super excited as well. And that's kind of like the in-between. Let's hear about them. And then when they come to the event, hopefully all of them will be back again to, have more conversations. So just trying to make it easy for everybody. It'll be just 2 days going through. You can hit all of the top major ones out there, such as like Taylor, Vivermed, Atlas, all these big ones that you've heard from. And it'll be nice to just to ask questions, right, in an open forum that maybe you don't have a full hour to dedicate to one of these companies at the time.
And is that NAMAPA's social they would follow, or Advocate Summit have its own?
Advocate. So the Healthcare Advocate Summit.
Perfect.
And if you, if you go to advocatesummit.com, all of those links are at the bottom. But I would put, if you want to fill out the contact us, I think that automatically enrolls you in any of the information. But yeah, it's pretty exciting. It's nice to just be able to have a group that can kind of start moving the needle on these things. And while we all love our day jobs, I'm just glad that there's groups and time and people want to help make a difference. And I don't mind extra friends. I love meeting other people in the space, and just shared learnings is the biggest thing.
So good. Well, we really appreciate you being on the show and just kind of unpacking what you guys have going on. And obviously, I think anybody listening to this is going to see a lot of value in attending that event. And so people can find you, like you mentioned, just do a Google search for Healthcare Advocate Summit, look for social media, look at NAMAPA, and that's NAMAPA. But Melissa, co-founder of Healthcare Advocate Summit, we really appreciate you being on the show.
Thank you guys so much. I appreciate it and look forward to hopefully seeing you next year in the crowd.
All right. Great discussion with Melissa Paige. I love that they are just pushing for advocacy, bringing advocates together, and really just enabling everybody to be more effective at getting patients access, getting patients the care they need. So definitely encourage you to check them out and sign up for that next conference. And if you haven't done so already, do yourself a favor and give the WeInfuse software platform a test drive and see how it can save you lots of time and money in your practice. And for those of you that have been listening over the last months or years, I just want to say thank you for being on this journey with us. It has been a huge blessing and pleasure to be the podcast host and connect with you guys through the airwaves and talk with guests and all of us kind of in that together. And I really appreciate you guys being faithful listeners to the WeInfuse podcast. And I think you are going to be pleasantly satisfied as Amanda Brummett takes the baton and runs with it. She brings a lot of unique experience that I don't have in the industry. And she also just brings a unique skill set and insight. And she's just a great communicator. So I think you really are going to enjoy the value she brings and see how much of an improvement it is to the show going forward. So thank you for joining us. Definitely reach out to NAMAPA or the Healthcare Advocate Summit and just enjoy the show into the future. My name is Dylan McCabe. It's been a pleasure to be with you, and we will catch you in the next episode.